Hayden H. patients possibly exposed to fatal brain disease at Manchester Hospital, Health, Boston.com. Listen live. Boston.com. Home. Today's Globe. News. Your town. Business. Sports. Lifestyle. Things to do. Travel. Cars. Jobs. Real estate. White Coat Notes. September 4, 2013 vertical bracket 4:08 p.m. Hayden H. patients possibly exposed to fatal brain disease at Manchester Hospital. By K. Laser, Globe staff. Comments left parenthesis right parenthesis. Email story. Print story. By reprints. As many as 8 patients at a New Hampshire hospital may have been exposed to a rare, fatal brain disease from surgery equipment that previously was used in a patient who likely had the incurable disease, state health officials said Wednesday. The patients underwent neurosurgery at Catholic Medical Center in Manchester between May and August and have been notified of their potential exposure, the officials said during a news conference. Additionally, the equipment, rented from Minneapolis-based Medtronic, may have been used in 5 patients in other, unnamed states, before health officials realized the instruments may have been contaminated with brain tissue from the initial patient. That person had brain surgery in May, but only last month was it discovered that the patient had symptoms of Creutzfeldt-Jakob disease. Health officials said the risk to the patients believed to have been exposed is extremely low. But after extensive expert discussion, we could not conclude that there was no risk, so we are taking the step of notifying the patients and providing them with as much information as we can, said Dr. Jose Montero, Director of Public Health at the New Hampshire Department of Health and Human Services. Our sympathies are with all of the patients and their families, as this may be a confusing and difficult situation. Health officials said the standard methods for sterilizing surgical equipment does not kill the tiny proteins, known as prions, that cause the rare disease. Dr. Joseph Peep, Catholic Medical Center's chief executive, said that in order to be 99.99% sure the equipment is sterilized completely after surgery, such harsh chemicals would need to be used that the instruments would be ruined. It has such a rarity. It is just not practical, he said. No hospital throws out their instruments after each and every surgery. The incubation period for Creutzfeldt-Jakob disease, the time between when patients were exposed and when they start experiencing symptoms, can be anywhere from a year to several decades, health officials said. Once symptoms appear, the average time to death is about 4 months, said Peep, Catholic Medical Center's chief executive. There is no treatment, there is no cure. Health officials said there is no risk to the families of the patients who may have been exposed, nor to other patients at the hospital. The disease cannot be transmitted through the air or through touching or most other forms of casual contact, according to the National Institutes of Health. ? Previous post. White Coat Notes. Next post. Comments left parenthesis right parenthesis. Email story. By reprints print story. Span point DRC _box _header span left curly bracket float. Non-important right curly bracket. Number login form left curly bracket display. None right curly bracket. Login to comment. Already registered. Just log in. Fields are required. Email. Password. Forgot your password? Please note, if you've previously registered with Facebook in Boston.com, for security reasons, you will be required to create a Boston.com password to access the area of the site. Please click here to create your password. Not registered. Signing up is easy. Please take a minute to register. After you register and pick a screen name, you can publish your comments everywhere in the site. Posting policy. Register. Your comment is subject to the rules of our posting policy. This comment may appear on your public profile. Public profile fact. About this blog. Laser is a health reporter who focuses on aging, sports medicine.